You can proceed.
Hello,
Hello,
I'm
hello.
Larry, one of the doctors in medicine OPD. Can you please confirm your name and age for me?
Hi, I'm Kevin Laurie. I'm 50 years old.
Okay, is it okay if I call you Kevin?
I'm sorry, your voice
Is
is
it
breaking. Can you just repeat that?
is it okay if I called you Kevin?
Yeah, yeah, Kevin is fine.
All right, nice to meet you, Kevin.
Hi, thank you.
Yeah, I can see from my notes, Kevin, that you were here about 6 weeks ago.
Yeah,
Yeah, can you kindly tell me the reason why you came here 6 weeks ago?
yeah, I had some cough for like 5 days, and then I came because it wasn't going down. And when I came, they said that they did some X-ray, and they said that I had some infection.
Oh, I see. Okay. So, apart from the cough, did you have any other symptoms?
No, nothing.
Okay. So, when you came, what medication did they give you?
They gave me antibiotic.
Hello?
Can you hear me?
Hello?
Hi, can you hear me?
Yes,
Hello?
I can hear now.
Yeah, yeah. So they gave me an antibiotic, amoxicillin, but that was a wrong antibiotic they gave me actually. I mean, even I didn't know that I was allergic to penicillin apparently. But yeah, they stopped that after 2 days.
Okay. I am sorry about that, Kevin. How about now, Kevin? Do you still have the cough?
No, but the antibiotic gave me like a lot of vomiting and stomach upset and all that. But yeah, now I'm all fine.
Okay, I'm sorry about that. So the vomiting and the stomach upset has resolved.
Sorry.
The vomiting and the stomach upset has resolved
Yeah,
now,
yeah, yeah.
Kevin?
It's all. I'm all fine now.
Okay, Kevin. I have some updates about your treatment, but before we proceed, I would like to ask a few questions if that's okay.
Yeah, yeah, sure.
All right, Kevin. You said you no longer have the cough, is
No,
it?
no, no. I don't.
No chest pain,
No, it's all fine.
no fever.
No.
All right. A bit about your past medical history. Have you ever been diagnosed of any medical conditions?
No, not really.
Oh, okay. You mentioned that you're allergic to penicillin. Is there any other thing that you're allergic to?
No, no. I mean, I hope
Is there
not.
any okay? Is there any medication that you're taking routinely, including over-the-counter and
No,
supplements?
no, no. I don't take anything.
Okay. Okay. Is there any family? Do you have any family history of any medical conditions like asthma,
No,
sickle cell?
no.
Okay. All right. Okay. Okay. Okay, Kevin. Well, you were here 6 weeks ago, and you they did an X-ray for you, yeah,
Yeah.
and then you were diagnosed as having pneumonia, and you were given some medications.
Mm-hmm.
Okay. Kevin. I have some unfortunate news. Well, 6 weeks ago, when the diagnosis was made, I am sorry to say a mix-up. There was a mix-up. So the diagnosis they made was based on another client's or another patient's X-ray.
Okay.
Okay, so what it means is that you were treated, you were given treatment, and the treatment they gave you was based on another patient's X-ray,
Mm,
including the diagnosis that was made.
Are you kidding me, doctor? Are you joking right now? I mean, you're telling me the antibiotics I got. I'm telling you that the antibiotics I got were wrong, and you're telling me that the antibiotics I didn't even need to get the antibiotics.
I'm sorry, Kevin. I know you must be upset right now, and I apologize for this error. I don't know how it came up. Um, but well, I want to assure you that the hospital takes this kind of events very seriously, and we are going to. I'm going to have to fill an incident report, and I'm going to document this conversation that I'm
2 minutes
having,
remaining.
and I'm going to document this conversation that I'm having with you, and also involve my seniors, so that an investigation will be conducted to find out exactly where the problem was, or where the error was committed. Is that okay, Kevin?
Yeah, I mean, that's all fine. But what about my X-ray? What happened to my X-ray?
I don't know where the mix-up was, but the the diagnosis was made, and the treatment you were given was based on another
Okay.
patient's X-ray. So
So
there
my
was a
X-ray is
mix-up.
lost, is it? Like, no, but did I have the infection?
Kevin, it will be difficult for me to say right now, as I do not have the full reports. But
Okay.
like I said, I'm going to involve my seniors. I'm going to fill an incident report form,
Yeah,
and
but
an
I want
investigation
to complain,
will.
doctor. I want to complain. What do I do?
Yes, Kelvin, it is within your rights to complain. We have a service in the hospital known as the Patients Assistance Liaison Services, which is a PALS. So I can refer you to go to them, and you can complain to them, and they would take the matter up from there. Is that okay?
Yeah, fine. But what about what happened to the other patient who was supposed to get the antibiotics? He must have not received the treatment that he needed, right?
Yes, in fact, Kelvin, you have
Move on to the
sparked
next
my
station.
interest, and I would.
All right.
Okay, all right.
That was good. That was pretty good. Mm. So, did you read the question? I mean, I hope you can
I
see
thought
the.
I said that Laurie's chest X-ray was reported as normal. Yours was normal. Okay. I think I missed that part.
Yeah, I realized that. Yeah,
uh,
you must not have read that
uh,
part.
uh, yeah. Well,
Yeah, so make
I
sure
missed
the
that.
first 1.5 minutes you make sure you read it properly. Like that's all your task is.
Yes.
Don't think about the previous station. Don't think about what your next station is going to be. Just focus only on this candidate info in that 1 minute 30 seconds
Yes.
and nothing else. Because
Okay.
that
All
gives
right.
you so much of information already, right? Like, because if you see from just reading the question you can tell that this patient has already received a wrong antibiotic, and then
Yes.
he got the wrong finding, and he but he was supposed he was no, he's normal. So that there's, out of all the bad things, there's one good thing that you can tell him, that is he's fine. Right, like, so
Yes. Yes. Yes.
try to think about it in that way. Like, what are you what news are you going to deliver to the patient? But make all that in when you're reading the case itself, in that 1 minute 30 seconds itself.
Yes.
So the examiner will give you more
Ah,
detailed feedback, but
the internet is a little. Hello.
other than that, it was pretty good. The one thing
Uh,
that I noticed was that you took too long data gathering. Like,
Yes,
when
I
did you
always get confused with the. I always get confused with the medical errors and how much you're supposed to focus on data gathering.
Hmm. Yeah, I know that's a. So the thing is, always keep in mind that you only have 4 minutes for data gathering and 4 minutes for management. So it's you always have
Okay.
to somehow, bring cut down your data gathering whenever you know that. So what is this station? This is an angry patient station, right? So angry patient breaking bad news stations basically will have most of the thing you have to do is emotional and empathetic responses, and you just have to deal with the emotions mostly, so which is mainly management if you think about it.
Yes, yes.
All right, I think the examiner is ready. She'll give you more detailed feedback.
Okay, thank you.
Hi, Dr. Lari. Good attempt. That was pretty
Hello.
good. So, yes. So when I just want to ask you. I just want to understand how you were approaching this case. So when you saw the candidate info, what kind of case did you think it was? I know you did ask for a symptomatic differential, but we thought we'll just spice things up a little. So, when you were reading the
Yeah,
case, what did you think the type of case was?
when I read, I knew it was a medical case, so I was suspecting an angry patient.
Yes, that's good. So, angry
Hello,
patient was a good suspicion. So in angry patient, there are two types again. So there are angry from the beginning, like they are coming with an issue,
Hey,
or it could be
my
angry after
Wi-Fi has
disclosure.
decided to fail me today.
I'm sorry. I'm sorry. Can you please repeat that? Did you say
Hello,
something? Yes. Can you hear me? Hi, Dr. Lari. Can you hear me? Hello, hello. I think we lost Dr. Lari. Doctor, can you hear me? Can you
I'm
just.
here.
Oh, okay, that's great. Okay,
Yes, I
sorry.
can hear you now. Yes.
All right, that's good. That's good. So, yes, so we were talking about angry patients. So, there are two types of angry patients. It could be after disclosing a certain news, or they are coming with an issue, right? So, these are two types you can encounter.
Yes.
So, if you saw this was actually you had to tell him that there was a mistake. So, this was more towards the line of after disclosure, right? So the approach
Yes.
towards these cases, you know that you have some time for data gathering, but the main ask of the task is to disclose the information and then deal with the patient. If you even see what must you do, the question, it says talk to the patient, explain the medical error, and address the concern. So you don't need to data gather so much. The only data gathering you
Okay.
will need is to make your point, right? Because this is not a station where you're trying to diagnose them. You already have a diagnosis, right? You're supposed to explain. You
Okay.
need to gather that information to make your point, right? I think that's one place that a lot of people find difficult because they tend to go into doing a lot of data gathering. So let's just look at some helpful tips. So this is a new tool that we have made. We just released our
Okay.
tool called Workbench. So we have all the cases from different topics, and we've populated them. So it'll be easier for people to understand how to approach these cases. So, if you see in the case scenario, the approach itself, it tells you that the patient, this is the information that you will get from the candidate's information. So, he has come with 6 weeks of cough, was hospitalized, and based on an x ray, he was given medication, right? And
Yes.
the x-ray was somebody else's, but after review his x-ray was normal. So there have been two important instances that has happened in here, which is the x-ray was wrong, and the medication that was given he was allergic to, right? So this is the
Yeah.
main ask of the task. So now what you need to deduce from talking to the patient is what was his experience, right? How is his current condition? Is there any complication that has happened from the medication, right? These are the things that you need to confirm from him, so that that's the that's the way you can disclose the news. So the data gathering
Okay.
should have been more towards those sides. So let's look at the data gathering points. So you definitely did ask the full name and age. That's good. And the reason for the visit and current symptoms. So the reason for the initial visit, that's also something that you gathered properly. Like, what was the symptoms that brought you to the hospital? And he said cough, but he didn't have any other symptoms. So you should have asked other symptoms of pneumonia, which you did. You asked about fever and any other respiratory issues, but he said he didn't have, just the cough, right? So ask
Yes.
about the hospital admission, like why was he admitted, like on what basis. So he himself will say that on x-ray, they did x-ray and they said I had an infection. So that was the information that he's providing. So now it's actually coming into your mind what happened in that instance. Like, what was the incident that took place? So he came with cough for 5 days, and an X-ray was taken, and they saw that it was pneumonia, and they admitted him, right? But it was the wrong X-ray.
Yeah.
That's what was uncovered, right? Now you're trying to understand what was the complications, or what was the situation that the patient was in, because that is the thing that you need to address further going on. So he'll tell you mostly. So that's the thing that you need to ask, like, how was your hospital admission? What were the medication that was given to you? Did you have any issues with the medication? Yes, you realize that you were allergic. Did anybody ask you beforehand if you have any allergies, right? Because this is the point you're trying to make. You need to go more towards allergy. So asking about any family conditions and all, that is important, but given the time, it's not that necessary. There are more things that would take more of your time, right? You need to
Okay.
allocate your time
Okay.
to something more important for the task. So yeah, going on those lines, you will understand that he was given the wrong kind of medication, and that caused him a lot of abdominal upset. But then they stopped it, and then he was discharged after 2 days. And now, current presentation and current condition, basically, he has nothing. He's absolutely fine. He's just come for follow up. So now this is the situation that you've understood. Now, after you understand this much of the situation, you need to disclose what you have to say, which is explain to him that there was a medical error that occurred. So, put it in a layering form. Say that I have some important information, there is some important development that has happened regarding your admission. Unfortunately, the X-ray that was used to diagnose you to have infection was another patient's X-ray, and instead your X-ray was normal, right? Once you've said that, like, once you've disclosed your misdiagnosis, that's when you should take a pause to understand what is his reaction, because you need to let him gauge the understanding of the situation. So after you say that much, he will have a reaction which you're supposed to wait for, because your next reaction should be tailored to what his reaction is. Do you understand? Like, if I'm actually trying to
Yes.
make a point to you, I'll wait for your response to understand what to say
Yeah.
next.
Yeah.
Right? All right.
Yeah.
So after
Yeah.
you disclose your information, pause, wait for the response. Whatever the response is, you need to validate that, understand the emotion. He might be peeved, he might be very angry, he might be upset. Whatever the reaction is, you need to understand, because this is very subjective to different people. It happens that in this situation, this person supposedly becomes angry. So you need to learn how to react to that, because that is something that you kept delaying. You weren't saying it in a way that it's a mistake and yours is absolutely normal, and we've given you the wrong kind of medications for that as well, right? So all this thing
Yeah.
is, all these events is something that you have to make sure that the patient understands. So if you see, that is what the in interpersonal skills, you are trying to make them understand what has happened, so that they gauge the situation. That is one of the ask in the task. They will be checking if you're doing that properly, if you're delivering the information that you
Okay.
are needed to deliver, right, in simple words, in the right kind of sequence, without putting blame on anyone, right? So, and then after you do that,
Yeah.
you have to take a neutral stance, saying that we are doing everything in our power to rectify this, We will be then he'll be like, what are you going to do for me next, like what is going to happen to me? Is like, as of now, since you have no current symptoms, there is nothing further to be done medically. But regarding the incident, we will be definitely looking into that. We take these things very seriously, and we will be investigating it and documenting it in incident report so that the hospital authorities can review it. We hope this doesn't happen to anyone, right? That is what you're going to say, and the
Yeah.
rest of it you're supposed to wait for what his reactions are. Do you have any other concerns? Is there anything else that you're expecting from today's consultations? So that's when you need to uncover. So if you have to uncover what is, going on in his mind, you have to ask him ice. See, idea already you've given. Now the rest of the conversation, the way you continue it is by doing ice, right? That way he will
Okay.
give out more of his emotions, and you will be able to answer it, right? Because even the simulators in the exam, they have a few questions that they need to ask. If you don't ask them to ask that question, it will never come to that, right? So when
Yeah.
it came to the point where you were disclosing the information, it was already, I was looking at the time, it was already 6 to 7 minutes. It was 6.5 to 7 minutes. So you didn't have much time to converse this much of information, which was the main point to do in this station, right? So data gathering was
Yeah.
was something that you need not have worried about so much. You just needed to understand, have full clarity of the situation before talking about it. That's the only data gathering that you need to do. Yeah.
Okay. Yeah.
I hope that was helpful.
Very, very helpful. Very, very helpful.
Thank you so much. So a couple of things
Thank
that
you
we
too.
so if you still have time, a couple of things that we wanted to tell you before you go to the exam.
Yeah, sure.
Yes.
Sure,
So
sure.
basically, in this exam, as you know, it's 16 stations, and what they are trying to assess is if you are recruited as an NHS doctor, how will you handle the situation on your first day? So you could be recruited as an FY1, FY2, or any other positions, even in a specialty position as well. So how would you handle yourself given the situation? So think
Okay.
about all the range of situations that you can have. There can be a breaking
Hello.
bad news. Can you hear me?
Hello.
Hi, hi. Can you hear me?
Hello.
Hi, I think we lost you again. Dr. Lari, can you hear me?
Hello.
Hello, hello, hello.
Yeah.
Hi. Oh, that's
I'm
good.
sorry, I lost you a bit.
All right,
I
that's
lost you a bit.
all right. So
So,
good, we got you back. So yeah, like I was explaining,
yeah.
so think about yourself having to encounter a whole wide different range of situations. It could be ranging from breaking bad news, an angry patient, it could be a counseling situation, right? So think about the interactions you need to have
Yeah.
like that. So those are the different kinds of stations that usually come. So there will definitely be one breaking bad news, there will be one angry patient, right? There will be a
Okay.
symptomatic differential for sure, because definitely you should know how to diagnose. So there might be 2 or 3 stations of that. There might be examinations. There'll definitely be one sim, there will definitely be one
On prescription.
prescription. There'll be one medical
Yeah.
ethics
Okay.
to see how you handle yourself. So that
Okay.
is the range of things, personality roles that you need to perfect before you actually start practicing. I think that's what they are looking for. Like, are you able to, conduct yourselves in such a different wide range of roles?
Okay.
But
Okay.
other than that, the
Yeah.
way your interpersonal skills are really good. Your the way you're giving pauses. Uh, the one thing I noticed is the management section. You're just saying a lot of things in one go. That's because
It's
you're
because
spending
I
a lot.
realized that my time was almost up.
Exactly, right? So
Yeah.
always try to do your data, reduce your data gathering. It'll be a little difficult, but try to reduce that because you will be missing out on a lot of management marks, because that's where after you give your management is when all the patient's actual concerns will come out. So till then, if you
Okay.
waste so much of time in making your diagnosis, then you won't be with the patient. The patient won't be able to tell you what their actual main problem is. So always try to
Right.
finish your data gathering by 4 minutes somehow, and that way you'll have plenty.
Okay.
So today I think you started your management at, you disclosed the error at somewhere around 2 minutes, like
Before
two
six
and a
minutes,
half
yeah.
minutes left. Yeah.
Yeah.
So
Yeah.
so that's why you
Yeah.
had to, you felt like so that will happen in some cases, but don't take that as a fact that you have to finish everything else. So even if you have only 2 minutes left, try to still ask the patient what his main concern is, what would he like to talk about today. Like, because
Okay.
that's what they are looking for. They're looking for, if you're going to if you're just trying to give all your knowledge to the patient in one go, or if you are actually trying to have a conversation with the patient to see what the patient's what the patient wants to hear about mainly.
Yes, that's
Okay.
a very good point. And yeah, I would definitely
Yeah.
agree with what Dr. Rohit just said. Your interpersonal skills are really good, but you have to get to the point. You have to get to the point faster.
Hmm.
I mean,
Yes. Yes.
I
Yes.
kind of felt that you were avoiding the point because it's a
Yeah.
difficult situation.
Hmm.
That's something that you should try
Yeah.
not to do.
Yeah. Just be
Okay.
very confident. Just think about it like it's just a regular conversation where your one of your relatives is coming to you asking for medical advice. Don't think about it like an exam. That's where most people have problems. They'll start getting nervous because it's an exam.
Yeah. Right.
Hmm. So you have 2 days.
That's a
You have
lot.
one day for your exam now, and so one advice that we give everyone is the day before exam, do not try to study anything new. Just try to relax. Even go out, watch a movie if possible, but just try to keep yourselves relaxed. Get enough sleep the night before. Do not try to cram anything the night before. So it's ultimately an
Okay.
endurance contest if you think about it. You have to stand there in the exam center for 5 hours continuously. So make sure you
Yes.
get enough rest. And yeah, I think you are
Okay.
there.
Yeah, you'll do great. I mean, just make sure like you're having a conversation because
Mm.
ultimately by the end of the day, that's exactly what you're doing.
Okay. Okay. It is just a little difficult to remain calm, and because I've just been thinking about it, how to try and remain calm. Because once you are calm, then all the information will be organized. Otherwise,
Yeah.
it's just very difficult.
That is very true.
Mm.
Another thing is if one
Uh,
station goes badly, make sure you don't get nervous.
um,
Hmm.
Okay,
Yeah,
hi.
you have a leeway of six stations, so that's perfect. So so the thing is, you have 6 stations that you can fail. Keep that in your mind. So even if you mess something up, it's fine. Just leave it. Go on, move on to the next station. Oh, I
Hello?
think someone
all
messaged
right,
something.
sure.
During the rest station,
Can you
can
visit
visit
the
the
loo?
loo,
Yeah, yeah,
yes.
yeah. You can.
Okay.
There will be a manager who will ask you if you want to go to the loo every time you enter a rest station, and then they will take you there and bring you back before the next thing comes also. So you don't
Yeah.
have to worry about that. Yeah.
But yeah, you can only go to the loo during the rest station. There will be two rest stations.
And they
And
will have a lot of cookies
Okay.
and coffee and water and everything in the rest station also.
yeah, I know the best is to just sit
Okay.
down and just, just calm yourselves, wait for the next station to come. But yeah, going to the
Right.
loo is also a great option because I remember even I did
It'll
that.
pass very fast that way, the
Yeah,
time.
that's true. But another thing about the rest
Yeah.
stations is that
Yeah.
it can be at any point. So you can start with the rest station